Hello. While a hair transplant might seem to you as a social emergency, something that you want to get immediately, it still falls in the realm of elective surgeries because it is a cosmetic surgery. Therefore, meticulous planning and ensuring the medical and surgical fitness of a patient before undertaking the procedure is of utmost paramount importance. I will now elaborate on the tests that are essential before a hair transplant, 10 tests that you have to do depending upon the discretion, depending upon the judgment of your treating doctor, 10 tests that are most commonly done before a hair transplant procedure. Out of these, 5 tests are those which are an absolute must. The other 5 are recommended by your treating physician on a case-to-case basis. To know what are these 5 tests that are an absolute must before traveling, especially those who are traveling abroad for a hair transplant, they do not want to land up in a clinic to be told that they're not fit for surgery. Better safe, better prepared than sorry. First, I'll be narrating the 5 tests which are essential. Number 1 of which is the complete blood count, commonly known as CBC, which comprises hemoglobin, total leukocyte count, and differential leukocyte count. That is a count of the white blood cells. Number 2 is random blood sugar. Sometimes when a patient gives a history of diabetes in the family, blood sugar fasting and postprandial may need to be done. Also, HbA1c levels may need to be done in such cases, especially in cases who you suspect to be suffering from metabolic syndrome or pre-diabetes. And then we go on to the coagulation profile, which comprises bleeding time, clotting time, prothrombin time INR test. INR test is very important in those who are on blood thinners, and we need to have a normal value before a hair transplant procedure. Once the blood thinners are stopped, we need to do an INR to make sure that the patient will not bleed during the procedure. And then we go on to the most controversial tests, the serology test. And allow me some more time to talk about this test before we go on to the 5th important test. 3.6% of the population is HIV positive. This may seem very innocuous, an innocuous number, an innocuous percentage, which you may ignore. But when we put it differently, 1 in 25 patients who come for a hair transplant is HIV positive. That means if a clinic is doing 10 cases in a day or even more, every week the clinic is unaware that 3 patients with HIV are being operated upon. And when you're doing so many cases, overlooking this fact and not being prepared for it may be a very dangerous thing for the staff as well as the patient. This number also appears disturbing when we hear of clinics doing several cases in the same room, mixing instruments, using the sapphire knife which may not be adequately sterilized before the next procedure, punches being shared from case to case, and so many other common instruments, common facilities, common operation theaters not being cleaned before the next patient is let in. Though universal guidelines are heavily weighed against testing for viral markers and surgeons are goaded to utilize universal precautions to prevent exposure, the argument in favor of universal screening is equally strong. Universal or routine HIV screening for HBV viruses, has been often described as a risk reduction strategy. Universal or routine screening for these viruses, for these viral markers, HIV, HBV, and HCV, has been described to be a risk reduction strategy from a staff, health, and infection prevention viewpoint. And moreover, after a sharp injury, the surgeon can begin post-exposure prophylaxis immediately without encountering the difficulties of patient consent for subsequent HIV testing. Recently, it has been suggested that routine testing for these viral markers may benefit the patients as well, from detection of unknown cases and management of these cases before a full-blown disease, AIDS, cirrhosis, and even liver carcinoma. However, needless to say that the results have to be kept confidential. This said, screening for HIV, HBV, HCV is a routine practice today in many clinics the world over. These investigations are done to prevent transmission from the patient to the healthcare worker so that adequate prevention measures can be taken through enhanced personal protective equipment PPE during surgical procedures. Number 3, to decide on the sequence and placement of the patient in the OT list for the day. Fourthly, to decide on the nature of equipment and environmental decontamination following the procedure. And lastly, very important in hair transplant procedures, to decide on the technique in which you would like to do a hair transplant procedure, because transmission decreases when you use FUT in place of FUE hair transplant surgery. However, there are three major criticisms against this universal screening strategy, and they are: many of the concerns that arise out of contamination, cross-contamination of HIV, HCV, HBV viruses can be overcome by utilizing, in all cases, universal precautions. But these may be very difficult to utilize in hair transplant surgery when you are doing FU hair transplant, when you're using magnification and you cannot wear adequate eye cover, and you are constrained and cannot wear PPE masks. Number two, with emphasis on universal screening, the emphasis appears more to be in the prevention of transmission from patient to the staff rather than in case detection for HIV, HBV, HCV, and subsequent care of the infected patient. Thirdly, and very importantly, universal screening does not appear to give attention to sensitivity and specificity issues in relation to these screening tests and the concept of window period negativity, which does occur in some infections, especially in HCV. However, whenever the clinic does routine screening, patients should be given pre-test counseling as per the guidelines of NACO, that is National AIDS Control Organization. The interest and concern about virus transmission from patient to the staff is a positive development. But it is desirable that this concern is not only restricted to virus transmission from patient to staff, but also from staff to patient, environment to patient, and patient to patient. Unfortunately, especially when a large number of cases are done in a clinic, there could be instances of the operating staff doing an exposure-prone procedure on patients without themselves being tested for HBV, HCV, or HIV. It is common knowledge that clinics which do a large number of cases throw caution to the wind and do not practice standard precautions and even basic hand hygiene when dealing with patients on the table. In the final analysis, if not universal precautions, there is no substitute for standard precautions while operating on a case of hair transplant, especially when you're doing FUE procedures. Universal precautions also help the clinic from preventing the spread of infection amongst the staff against till now undetected pathogens, undiscovered bacteria, undiscovered viruses that are hitherto unknown. Number 5, we go on to testosterone in estradiol levels, and these help us in determining which patients are fit for taking DHT blockers following the hair transplant procedure. And now we go on to the 5 points, 6 to 10, which are advised only on the discretion of the treating physician. So the 6th test is ECG or electrocardiogram. A doctor, if he finds an anomaly in the ECG, may send the patient for stress test or even Holter assessment. Then we have the antibiotic sensitivity test. 8thly, the lignocaine toxicity test, the thyroid profile, especially for women, and lastly, at times, a scalp biopsy might be needed. So these are the 10 tests which a doctor may advise before a hair transplant surgery. So what are the conditions when a hair transplant can be cancelled on the day of the procedure if the patient has not revealed his medical history or he has not revealed his biochemical reports much before coming in for a hair transplant? Number 1 is hemoglobin. Hemoglobin levels less than 10% make the patient more prone to developing infection after the procedure. Abnormalities in WBC counts can also lead to infection. Elevated blood sugar levels that a doctor detects on the day of the procedure are a big no-no for a hair transplant procedure because multiple slits are made in close proximity, and especially when you're doing high-density hair transplant, there is a chance of skin necrosis and later septicemia. Many such cases have been reported when wanton hair transplant surgeries have been done without screening the patient for diabetes. HbA1c levels more than 6 are not advised to be taken up for a hair transplant procedure. The next is derangement in coagulation profile. Positive serological tests for HIV, HBV, HCV, though they may not be an excuse for cancelling a procedure because we can always follow universal precautions, but it may help us in choosing the technique for hair transplant. FUE should not be done in patients who are detected to be HIV, HBV, or HCV patients. Such patients should be subjected to FUT hair transplant. Next, we go on to abnormalities detected on ECG, on stress test, or Holter testing. These patients may be declared unfit by the physician. Adverse reactions found during antibiotic sensitivity test or lignocaine sensitivity test may not be a contraindication for the procedure because they can be tackled easily on the operating table once known. Thyroid dysfunction tests may also not be a contraindication. Distorted levels are often seen in females. Histopathological tests suggestive of underlying scalp pathology which are at variance to androgenic alopecia, which we think we are treating, may be a contraindication for hair transplant procedures. And so are imbalances in testosterone and estradiol levels, because they may prevent us from initiating the patient on DHT blockers, which, if the patient is young, may not be a very good thing to take them up for a hair transplant procedure. In conclusion, a comprehensive preoperative checkup guided by clinical expertise and prudent evidence-based practices is indispensable before a patient can be taken up for a hair transplant procedure. Adherence to established protocols of test selection and interpretation underscores our commitment to patient care and procedural excellence in the field of surgical hair restoration. By prioritizing patient well-being over commercial considerations for profit allows us to uphold the highest standards of medical care and paves the way for happy surgical outcomes and overall happy patient and happy doctor and his team. Thank you for watching. If you have any question, any doubt in your mind about this talk, do let me know in the comment section below and I'll be there to help you. If you haven't subscribed yet, please do. Your engagement keeps the channel going. Thank you for watching again. Have a nice day. God bless you.